Can you hear me, Tasia?
It's nice.
Victoria?
Yeah. She has, I found her and I said, you have a student here that wants to know if you have time. Oh, sure.
Oh. Well, good. That's awesome.
Yeah. Here's a head scratcher.
Yeah.
I can get immunization records from people who haven't even applied to the program. And I can't get immunization records for people already in the program.
What?
Yeah, I mean, it's always been a struggle.
Really?
They just give me one at a time or not at all, and we're threatening them.
Right. Not getting in or whatever. Yeah.
But I can get them from people not even having applied yet.
Awesome. Very good.
It's like, oh my gosh.
Good grief. Oops.
Here's Tasia, guys. Here, help me unmute. Is it? Yeah. I need to unmute her. Okay. Do you want I should be able to. It says muted. I think it's saying that you can do that. You got it. Just right. Just now, God. No. Okay, yep, got it. Phone's not going through. Okay, now let her know next time. Sorry. Me, no, I got it. It's kind of the same view that they had.
Y'all hear us? Yes.
There you go.
Okay, perfect.
Can y'all see that?
Yeah.
All right. Sorry about the technical difficulties.
Thank you.
That's all good, thank you.
Y'all there?
Yes.
What you hear?
I think that's a bit of a trick question, don't you think?
Why aren't y'all here?
I don't think I made sense to you, Scrappy.
Hello?
Hello.
Can you not hear me?
Okay.
We can hear you.
Okay, the question was, why aren't y'all here?
There we go, being silent again.
Can you still hear me? Hello?
Yes, we can hear you.
Okay. Today's gonna be lecture day, sorry.
That's all good.
Okay?
Okay.
All right.
We're gonna play a little bit, but not a whole lot. Are you ready?
Yes.
Yeah.
Thank you. Okay, we're gonna go over chapter 1. So we're just gonna do the PowerPoint today. We'll come up with better ways to do it later. Got it?
Got it.
Okay. The overview of lesson topics for chapter 1 will be the emergency medical service, EMS system, medical technician, system organization and standards, EMS research, evidence-based guidelines, mobile integrated healthcare, community paramedicine, EMS and public health. Every Saturday, Ben Milton has breakfast at Dave's Diner with a favorite local from a small tourist town despite having diabetes, carrying an extra 40 pounds around his waist. 51-year-old Ben finds it hard to pass on Dave's breakfast platter of egg, steak, and fried potatoes. Imagine that. One by the time his coffee arrives, Ben isn't feeling so well. Just as his friend Arnie notices, Ben has turned pale and broken into a sweat. He collapses, pulling the tablecloth with him to the floor, wasting all the good food. What components of the healthcare system must be in place for Ben to receive immediate help? Y'all can answer too. What do we need to do for poor Ben?
If we're on scene, we would have to first make sure the scene's safe.
Okay.
Second, you would have to see if he's like responding, because I know it said he's collapsed, but see if he could, come up. Another thing is checking the heart rate, first pulse.
Okay. And
Sure he's not choking.
did you call 911?
I just didn't say love.
Okay. I'll speak up. I've been banging around steel and boats and all that, and all we cannot hear nothing. What weaknesses in a system could decrease Ben's chances for getting help? Huh? What weakness in a system could decrease Ben's chances for getting help?
Not getting there quicker.
Okay, what else? I know where he is.
Not having.
People's cell phones not working.
Yeah, available.
There's not been a landline in the restaurant. Right?
Yeah.
Anything else? Think of? Okay. Sudden loss of life and disability from catastrophic accidents and illness and major public health problems. Thousands of people die or suffer from the harm yearly because of lack of access to adequate EMS. EMTs can make a positive difference. What happens to an injured or ill patient before he reaches the hospital can make a critical difference. Lessons learned from observation in the Korea War and Vietnam Wars have impacted the development of modern EMS. The past care did not begin until the patient reached the hospital. In '66, the EMS white paper identified deficiencies in pre-hospital medical care, including lack of EMT training and lack of organized system. Now, before there was Band-Aid buggies or ambulances, patients went to the hospital in a hearse. I remember that. They would take you, throw you on the stretcher, put you in the hearse, and sometimes there would be somebody back there with you, and sometimes they just get up front. and drive you to the hospital. Then they would unload you. You didn't get care until you reached the ER doors. So you didn't get oxygen, you didn't get wound care, you didn't get a lot of things. Introduction of cardiopulmonary resuscitation, aka CPR, happened in the 60s. The Highway Safety Act of 66, EMS System Act of 73. National Emergency Medical Services Education Practice Blueprint in 93 by the National Registry of EMTs. The NHTSA documents in 1996 that EMS agenda for the future, 2000 EMS education agenda for the future, a systems approach, 2005 national EMS core content, and 2006 scope of practice model. In 06, Institute of Medicine report the future of EMS care. EMS at the Crossroads recommends common scopes of practice to allow reciprocity between states. National accreditation for all paramedic programs. Your reciprocity is that if you are an ambulance in Arkansas and they need you to go across the state line into Missouri, you can do so with your ambulance and your protocols, as long as you're taking that patient to the most appropriate facility where he belongs. If he needs to go to a burn unit, is there a burn unit here? That'd be a negative. So you have to bring them here, let the physician see them, and then they transfer them to their burn unit. That makes sense? If you don't have a burn unit, a trauma unit, and things like that, you need to go to the closest facility that you can get to so they can do patient care and stabilize them to where they can get them to the appropriate facility. Okay? And national certification is a prerequisite for state licensure and local credentialing. And EMS agenda for 2050. NHTSA provides a set of recommended state standards and technical assistance program assessment standards. There are 10 components. Regulation and policy, resource management, human resources and training, transportation, and facilities. Communications, public information education, medical direction, trauma systems, and evaluation. Emergency medical services, clinical practice, and systems oversight of 15. The clinical quality, service quality, economic efficiency, accountability, improvement, and resilience. Most common way for public to access EMS is by dialing 911. We also have enhanced 911, it's called E911. Automatic number identification and automatic location information if you are on a landline. This will not work for cell phones. The benefits of 911, the number is easy to remember and use. Public safety answering point. It is staffed by specially trained dispatchers. All emergency services, police, fire, and EMS are accessible by dialing one number. Cell phones pose some challenges to 911 systems. They are not identified with a fixed site, so the location is identified as the closest cell tower. Calls near geographic boundaries can go to a different tower. How many miles do you think your phone will pick up from a certain cell tower? How do you think the distance might be? 5, 10, 15, something like that, depending on, are you in a flat zone? Are you in a mountainous zone?
Valley.
Or down in the valley? Because if y'all know where the Buffalo River is, right? You go down South 14 and you drop off that big hill going down to the river. You have no radio in your truck. You have no cell service. You got nothing. But it's your, you're pretty much on your own. Okay? Voice over Internet protocol also poses challenges that is addressed by the federal communication rules. 911 service must be a standard feature, must give the physical location of where the service will be used. The provider must transmit all 911 calls to the appropriate ASAP. FCC rules are being implemented to improve cellular access to 911. Basic 911, phase 1, enhanced 911, and phase 2. Charlene, one of the waitresses in the restaurant, pulls a cell phone from her pocket and dials 911. The dispatcher immediately transfers the call to a specially trained EMD. The EMD asks Charlene a series of questions how to get help on the way and gives her instructions for checking and monitoring bids conditions until help arrives. So these dispatchers have a list that they go by step by step by step. They ask, what is the emergency? Do you need police, fire, or EMS? And they will ask the location, emergency, the address, what's going on. Is your patient conscious? Is he not conscious? Is your patient breathing? Is your patient not breathing? They have these series of questions that they go by. They pull it, it pops up on the computer when the call comes in. So when they ask these questions, they box. This way, everything is done step by step by step by step, and you don't miss anything. Like a critical question. Okay? That's how they do it. In case y'all didn't know. EMTs, Juliana Smock and Peter Sayer, run to the dispatch heading down Highway 129 towards Dave's restaurant. An anxious customer holds open the front door as Julian and Peter pull in to a stop in front of the restaurant, taking a look around at the scene. Make sure it's safe. EMTs grab their equipment and head for the door. What EMT responsibilities have Juliana and Peter demonstrated so far? Okay, they looked around the scene was safe. What else did they do?
They called 911.
Oh, we're talking about the EMT responsibilities. 911's already been called, and they're on the scene. They looked around, and now they're
Checking for information.
they're walking in the door. They ain't even got that far.
They grabbed their equipment.
There you go. They grabbed all their stuff. You don't have your equipment, you're pretty much not no good to anybody, are you? Right? If you're doing pocket masks, you mark how much oxygen you give it. Well, I'll tell y'all the other day. 21%. Would you rather have 21% or would you rather have 100%? 100. That's why you take your equipment with you. What EMT responsibilities do you predict that they will perform next?
Check the pulse.
Okay, before you check the pulse, what are you going to do?
Make sure
They did that. There you go, check responsive, right? If you shake your patient or tap your patient on the chest and ask if they are okay and they don't respond, what does that tell you? They're not okay, right? So after you do your check responsiveness, then what?
Check their breathing.
Check for breathing, how do you do that? Remember?
Put your ears by their mouth and watch their chest. And watch their chest rise.
Are they open or do you want it closed? Open. Y'all doing good so far. Now what do you do?
Just try to fall for at least 5 seconds.
Okay. You check for a pulse for how long, guys? 5 to 10 seconds, right? How will the EMT's appearance and actions determine how they are perceived by others? So, if you're not dressed appropriately and you got broom head when you walk in there, because you ain't combed your hair, you ain't had a bath, you worked on the truck for 48 hours straight, you kind of got this nonchalant attitude when you walk in. Do you want this person working on you or your family?
No.
No. You don't want to be neat, clean. You know how I am about clean. Don't do stinky people. Would you let those people work on you? No. Types of EMS systems. Variety of EMS system types exist in the United States. Fire department EMS. They will have a paramedic or on their pumper. Also, most firefighters on every truck are EMTs. That is a requirement now that they are making happen. Now, in certain states, in order to drive the ambulance, all you have to do is take a 16-hour driving course. You don't have to be a first responder, an EMR. You don't have to be none of that. You just take a 16-hour course, certain states, and here you go. You can drive the bandit. Municipal, private EMS, hospital-based EMS, law enforcement EMS. Hospital-based EMS usually has paramedics and EMTs on their trucks. Law enforcement EMS, there will be what they call tactical paramedic. The public safety officer. They're all running around making sure that your shoes are tied and everything is nice and neat, put away, and all the safety standards are met. EMS scope of practice model identifies 4 levels of EMS practitioners. EMR, emergency medical responder. EMT, medical technician. Advanced emergency medical technician, that means that they can start IVs, they can get saline, Ringer's lactate, small medications, glucagon, nitro, aspirin, things like that. Paramedics, they can do pretty much all of it. 4 levels, you just follow them. Healthcare system is a network of medical care that begins in the field and extends to hospitals and other treatment centers, including pre-hospital care and also out of hospital care. You may respond to, let's say, Mr. Ben is at the restaurant and he got sweaty down and he went to the floor. That what? What do y'all think maybe going on with Mr. Ben? Stroke? Okay, what else?
Cardiac.
What type of cardiac?
Cardiac arrest, if you high blood pressure.
Could it be heart attack? The
What'd you say?
Angina.
okay, angina, chest pain. But this dude actually fell in the floor, so probably heart attack. Different healthcare facilities they specialize in one thing, just like a physician specializes in nothing but cancer, or they specialize in nothing but cardiac, or they specialize in nothing but trauma on bones, things like that. Burn centers, OB center, pediatric center, poison center. No different than doctors that specify a certain specialty that they want to go into. And those are your choices. You have stroke center, cardiac center, hyperbaric center. They use the hyperbaric chamber for diving accidents. They also use them for wound care. Like for people with diabetes, they had to remove one of their toes or their foot. Or they've got a wound that won't heal, they'll put those people in a hyperbaric chamber. They'll bring them down to a certain depth and then flood the whole body with oxygen. So if your body is getting flooded with oxygen on a wound, that will help cure it or help heal it. Spinal injury center and psych centers. You get into EMS, you will see lots of psych centers or facilities. And this is what it looks like inside the trauma bed. You got one bed and a whole bunch of people. You got the ER doc, you got the nurse, you got the people document, you got the x-ray techs, you've got several nurses that are doing what the doctor wants them to do. X-ray techs, they take the x-rays. You got people starting IVs, you got people intubating patients. Trauma center is pretty cool how they're set up.
How many people are typically in there at once?
In the one room, up to 12. And plus you got people running in. Because if they need a certain bed, the nurse has to go to the fixes, pull it out of the fixes, bring it back, draw it up, give it. If you have to have a medication that is in the pharmacy and it's not in the fixes, they have to go all the way, they have to send the X out of the pharmacy and have them bring it to the room. So, it's big old controlled chaos is what it is. You guys will be working closely with other public safety personnel such as EMTs, paramedics on the pumper trucks. Some of your police are EMTs and paramedics too. Someone needs to be doing the traffic while you're out there in the middle of the road working on this cat. Make sure you don't get run over. You also work beside paramedics and like we just said, a bunch of other people. After quickly determining the nature of Rob's problem, the EMTs head toward the closest hospital, 35-minute trip. You then behind the wheel and Peter in the back of the ambulance. Parents have been having arranged for a paramedic unit to meet them en route. Peter gives the paramedics a quick radio report. What do you think he said?
In best condition, where he's at right now.
So if they think because he is pale, because he's diaphragmatic, because he's all these things, he went in the floor. They haven't told us if he's conscious yet. They haven't told us a lot of things that we need to know, right? So apparently they think it is serious enough to call for an ALS truck for a paramedic to meet them that have the cardiac monitor. They have ACLS drugs. They have everything that mostly EMTs can't do with the oxygen, things like that. So if all your ALS trucks are busy and they can't get to you because they're on other calls, are you going to stop and wait on them, or are you going to keep going to the hospital?
Hospital.
What y'all gonna do? Did they go to break? Y'all on break or something? I can't hear you.
Keep going.
Okay. How can you benefit your patient by an intercept with an ALS truck?
It could help because paramedics have more, like they can do more than EMTs can, so they're not.
So they're a little bit more advanced, right?
Yeah, that's where it's unfortunate. Think of it. They're more advanced, so they'll be able to give him more care than what an EMT can do. So it might help the Ben out in his situation, get him to the hospital. He's not breathing right now.
What are some of the potential pitfalls in the patient safety at this stage of the call?
The time lost towards the hospital can require.
Okay, you got time lost from the time you get called, when you get to your patient. You have time lost in figuring out what's going on with your patient, right? If you don't get that oxygen on them pretty quick, you say it is a heart attack, they require that more than they do anything at this point, right?
It only takes like 4 to 5 minutes of non-oxygen to your brain start
There you go.
losing brain cells.
EMT responsibilities. All EMTs share a common set of rules and responsibilities, maintain vehicle equipment and readiness, ensure safety of EMS crew, the patient, and bystanders at the scene, operation of the emergency vehicle, assess your patient, provide emergency care, safely lift and move your patient to the cot and then to the truck, right? Because that truck is your office. Y'all share a common sense of roles and responsibilities, prepare oral and written reports, safely transport the patient, transfer patient care, perform record keeping data and data collection, serve as the patient's advocate. What do you think that means?
You whatever you say about the patient is what everybody knows. Like, if, I
Make sure that the patient is protected from like other people. There you go. So basically, this patient can't do anything for itself, right? So when you are called, you are now there for the patient's advocate. You are looking out for the patient. You are caring for the patient. You are making decisions for this patient because they are not responsible, right? So you're doing all these things to, like what she just said, protect your patient and make sure your patient gets the best care that you can give them. Now, if you think it's a heart attack and you call for an ALS truck, you're not doing anything but benefiting that patient because you're getting into a higher level of care than what you can give, right? EMT share common set of roles and responsibilities. Integrate the EMS service with other and emergency and non-emergency service. Resolve the emergency incident. Resolve it. Maintain medical and legal standards. Provide administrative support. Enhance professional development. Develop and maintain community relations. So get along. Your other roles and responsibilities of being an EMT is to maintain your vehicle and your equipment readiness. Make sure all your stuff is there. Make sure your stuff is there where you can see it. Make sure it is clean, easy to access. Not only are you looking after your partner, you're also having to watch to make sure the bystanders are, one, safe, and two, behaving. Operation of the emergency vehicle is drive according to the rules, follow the rules. You're doing your patient assessment, do it like you're supposed to. Provide your emergency care, your O2, your oxygen. Safely lift and move your patient. Emphasis on safety. If you don't lift properly, you can end up with lower back. You can end up with left or right shoulder problems in the future. I know people that have been medics that have completely had to get their hips redone, their knees redone, both their shoulders repaired because they lived the wrong way. I've been doing this 35 years and only been hurt once because I lifted the wrong way. When you do your oral and written reports, you do them the same exact way every time. When we get into that, we'll go by step by step by step. And that way, once you get it in your brain that way, you won't ever mess it up. Safely transport your patient to the hospital. Abide by the traffic laws that are out there. Transfer your patient care to your RN or to your physician. For record keeping and data collection, serves as the patient's advocate, provide emotional support to the patient, relatives, and others at the scene. Integrate the EMS service with other emergency and non-emergency services. Resolve the emergency incident. Maintain medical and legal standards, provide administrative support, enhance professional development, develop and maintain community relations. So basically, be nice and get along and work as a team. The American Disabilities Act of '90 protects individuals with documented disabilities from being denied employment based on disabilities. Check with your state EMS ADA representatives to seek additional information on this paperwork. You cannot help the patient, other rescuers, or yourself if you are injured. Use safe driving habits. Do not enter or stay on an unsafe scene. Be alert to situations with a risk for violence. They're out there. Wear reflective clothing and protective clothing as indicated. Always you want to wear your vest and stuff if you're on NBCs or MCIs, because most people that you work for, if you don't have that vest on out there in traffic or on the highway or wherever side of the road or whatever you're doing, and you get hit, the insurance won't cover you because you don't have it on. Always keep in the back of your mind when you pile out of that truck, have that little vest on. I've done it 1,000 times and forget it. Luckily, I've never been hit. But there's been close, there's been a few times it's been close. Provide emotional support to the patient, relatives and others at scene. Sometimes you're not going to have time to do this. I'm kind of not here for the relatives. I'm here for the patient. And if I need to load and go, as soon as I determine that, that's what we're doing. Okay? What could go wrong with that picture?
A car could fall on top of them.
Mm-hmm. So obviously they've got it braced up on the other side, correct?
Correct.
So you've got several people working on the patient and somebody watching. Always want somebody watching. Even if it's just you and your partner, if your partner is working on that patient, you be looking around and making sure everything is going like it's supposed to. Because family members and other things like this, they will rush up on that patient and mess up what you're trying to do. When you contact medical control, you will be speaking to the physician, either radio or your cell phone. Always remember that if you talk to them on the radio, it is recorded. If you dial a certain number to talk to them in the ER, it is also recorded. One of those CYA things, cover your back. Okay? You're going to learn this in the documentation, not to forget nothing. Transferring to patient care at the receiving facility. Most people if I bring a patient in, I will be talking to the nurse or the doctor or whoever it is that is accepting the patient and going to sign for the patient. You can give your report and move your patient at the same time. Record keeping, data collection, and patient advocacy. Like I said, we'll get into that later. At the designated point, the EMTs meet the paramedic unit and give an update on Ben's status. Paramedic Alexis Brady further assesses Ben and implements advanced life support treatment. Following the treatment, which was administered, increased Ben's abnormally slow heart rate. Ben regains consciousness and is confused about what is happening. Now that Ben is conscious, what do you think is the expectations for how Peter and Alexis interacted with him? What do you think they did to help him out?
Explain.
They probably, when he came back around, while he was unconscious, they probably did what? Check pulse ox on him, see how much O2 sat he had. They probably did a glucometer test to see what his blood sugar was. They also probably gave him oxygen. Probably started, when the ALS truck got there, they probably put him on the cardiac monitor, did a 12 lead, read the forward lead, determined what the 12 lead said, started an IV on him, probably gave him a little bit of fluid. So, what do you think? So basically, we just answered the second question, didn't we?
Yeah.
Because of the treatment that he gave, or she gave, or they gave. Professional attributes of EMS as characteristics of professional behavior expected of the EMTs. Integrity, empathy, self-motivation, professional appearance and hygiene, self-confidence, and effective time management. Good verbal and written communication skills, teamwork and diplomacy, respect for patients, co-workers, and other healthcare professionals. You are also being the patient's advocate, careful delivery of the patient to wherever you're going. And you have to be a lifelong learner. So every 2 years, whether you're an EMT or a paramedic, you're going to be in class. Y'all have to have 30 hours of CEUs, continuing ed. And if you want to take other EMS related topics such as reading EKGs or cardiac monitor, 12 lead interpretation, all those classes count towards your 30 hours in your 2 years. Okay? There you go. Your attributes that are important to maximize effectiveness of the EMT is their appearance, knowledge and skills, physical demands, personal traits, maintenance and certification, and licensure, which we just went over with the 30 hours of class. Physical demands. You have to be able to tow things 4 to 5 miles back in the woods sometimes. That is, i.e. your Thomas pack with your oxygen, your stretcher, or your Stokes basket, or whatever it is that you're going to be using. Get ready, because you're going to have to tow it a long ways if you cannot get to your patient. State EMS agencies are responsible for planning and coordinating EMS. Every state and territory in the United States has a lead EMS agency. So if you were to go and play in a hurricane deployment, one company will be in charge of sending trucks and sending people to designated areas that need it the most. So when you show up, all you have to do is get with your coordinator. They tell you where to go, a lot of times how to get there, and what's needed when you get there. You'll already know in a little bit in advance what you're getting into. Not all the time, but most of the time. I mean, you may go in and wipe out, you may go in and move an entire nursing home in 4 hours, depending on how many patients you can get in your trucks and how many trucks show up to get it done. You know, for like flooding and things like that. You'll have to evaluate the whole place. All right, en route to the hospital, Alexis and Peter continue their treatment, and Alexis calls in a report receiving the hospital. As Peter continues to reassure Ben and monitor his condition, Alexis begins some preliminary paperwork. What is the legal basis for EMTs providing medical treatment to patients? What do you think? That means, what are you allowed to do? allowed to give oxygen, right? Nitro, you can give nitro if it belongs to the patient, correct? You can give Narcan, right?
Yeah.
Okay. So what you have is a set of protocols that you follow to match your patient. And also, don't go out of the above and beyond what you're allowed to do. Because you can get in some big time trouble for doing stuff that, even if you know how to do it, your license doesn't give you the weight to go ahead, oh, I can do this. No, you can't either, okay? Because you can't start IVs unless you've been to the advanced EMT advanced class, where they train you and they teach you to start IVs. So basically, you can't go over your scope of practice, or you'll get in big time trouble. All EMS physician or EMS systems must have a medical control physician. We even have one for this college. He is our medical control. So if we want to do something out of the ordinary or something crazy, he has to approve it. See what I mean? You have direct medical oversight, which is he is there with you, telling you what to do. Indirect medical oversight, which would be over the phone. On and offline medical direction is on the phone and on the radio. And on scene medical direction is your protocols. No doctor's going to most likely be out there in Booger Woods with you at 2 o'clock in the morning, is he? They got better things to do. Medical directors participate in EMS provider education, the EMS system quality assurance. A primary charge of medical direction is developing and establishing guidelines under which the emergency medical service personnel function, protocols, offline, and standing orders. Quality improvement is a system of internal and external reviews, audits of all aspects of an emergency medical system. May also be known as continuous quality improvement. They are constantly going. They're constantly going over your paperwork. So Johnny did such and such at the scene, and he cut a dive suit off somebody. Now the patient is mad and blah 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 blah. Johnny get in trouble for that? No. You have to expose to see what's going on, right?
Yes.
So
Just like you say.
just be nice and cut it along the scene of the deal. So with your quality control improvement person, they're going to sit there and they're going to nitpick every single thing you did, whether you did it right, whether you did it wrong. Those people are out there. They're little pin pushers. And they go over to see, could you have done it better? A lot of times they're not there, so it's kind of hard to judge what could have, y'all heard the phrase coulda, woulda, shoulda.
Yeah.
See, same thing. If you take an active role in quality improvement by your documentation, regular skill maintenance, preventable maintenance, continuing education, physician, nurse, patient feedback, quality improvement. It all turns into one big circle. EMS system organization and standards, issues in patient safety. Certain aspects of pre-hospital care are high risk in terms of patient safety. Transfer of care from one provider to another. Communication with other providers, carrying and moving patients, ambulance transport destinations, spine motion restriction. Errors during patient care can cause harm and usually result from improper skill performance, not following the rules, and the lack of knowledge. You guys will be excellent in the first one and excellent in the last one. When you get a job, you best follow the rules, okay? Research in EMS. Research does exist to support many practices in EMS. Research in hospital settings does not always transfer well to EMS settings. Why? In a hospital, you are in a what environment? Controlled environment. In EMS, you are not, because you have what factors you can't control in EMS.
Outside world.
The outside world. You have what? Other people, weather, location,
Their vehicles.
other vehicles. You've got all these things that can come rain down on you. And in the ER, you've got air conditioning, you have a physician, you have nurses, you have heat, you have blankets, you have everything that you need in an ER, right? So that's kind of like the Taj Mahal of emergency care, isn't it? Out there, you could have light, thunder, rain, sleet, snow, flat tires. Yeah, hail. Somebody can hit you. You have to deal with what?
Bears.
Bears. Okay.
Deer.
Deer.
I mean, if you're in the woods with patients, it could be a
You
bear.
can believe how many ambulance wipe out deer going from here to Springfield or here to Little Rock all the time. You know, if you see some of these ambulances out here and they got different colored fenders on them, they probably wiped out a deer or two. But you got to keep the truck in service. You got long enough time to get a new fender on it. Sometimes you can get it painted, sometimes you can't. It just depends on the need of the truck, how much the truck needs you. I mean, how much, how busy you are. You got to have that truck. I don't know about the participation in the research profession, but I guess it could be fun. Evidence-based medicine uses research to provide evidence that certain procedures, medications, and equipment improve patients' outcome. This knowledge can be used to develop evidence-based guidelines. National strategy should promote pre-hospital evidence-based guidelines development, implementation, and evaluation. So basically, if Johnny went out there and Johnny boarded somebody and they put them on the board with the board flipped upside down and they had the C-collar on inside out, all these things that go wrong, there you go. That way you can make sure everything is right. There are 4 steps in evidence-based decision-making. Formulated question needs to be answered. Search medical literature for applicable data. appraise the data for validity and reliability. If the evidence supports a chance or a change in practice, change protocols and implement the change in pre-hospital emergency care. There is a drug out there called lidocaine. The dose of lidocaine is 1.5 milligrams per kilogram up to a total of 3 milligrams per kilogram in one patient. There is no scientific study that has been done on lidocaine to promote that it stops frequent ventricular contractions in the heart. But we use it because we've seen it work. Do you have to have a scientific study on everything? No. But that's usually my number one go-to in cardiac emergencies that require that you get rid of preventricular contractions. Sometimes oxygen alone can do it. Evidence-based uses the same approach as evidence-based medicine to develop guidelines for medical practice. FICEMS and NEMSAC facilitate the development of the National Pre-Hospital evidence-based guideline model process. You must see scientific evidence proved in the following ways: ensure provision of safety care for best outcomes, demonstrate the value of EMS via outcomes, improve the safety of EMS in controlled environments, promote accurate and thorough documentation. Two different EMT data collection initiatives: cardiac arrest registry to enhance survival cares, National Highway Transportation Safety Board, safety in numbers. EMS data is important. Scientific mode: pose a research question, conduct a literature review, develop a hypothesis, conduct research study to test the hypothesis, collect and analyze data, support or reject hypothesis, identify limitations, the study, report the findings. Evidence-based guidelines still. Guideline model process starts with input from the national guidelines. Evidence is collected, evaluated, protocols are developed and disseminated. Following implementation, the process is reviewed for effectiveness. Ben was seen in the emergency department and then admitted to the cardiac care unit from the hospital. Ben's cardiologist told Ben that he has several risk factors for heart problems, but some of the risk factors can be changed. What do you think that might be? How can we change Ben's risk factors? What did they tell you about Ben earlier? They allowed
His diet and food needs.
Okay, got to eat fried potatoes, greasy bacon, right?
Steak.
Steak, that's good for you. Protein.
Fat and the grease.
There you go. How you're cooking. Fat and grease. What does fat and grease do to arteries? Clogs them. Builds up plaque, correct?
Yes.
What role could EMS providers take in such public health efforts? Are we going to go protest Taco Bell? McDonald's?
No.
No? We're just going to help them eat better, or try to. Global integrated healthcare and paramedicine. Integrated services provided by a variety of healthcare entities and practitioners in the EMS. Community paramedicine services provide the EMS agency and its EMS personnel. The object of the community paramedicine program is to keep patients out of the emergency room because they are so overwhelmed and overworked. If you can go to a patient's house and you can be able to explain all the medications that they get, how they work, what time to take them, what to eat with them, and help to get them on a schedule of medication, exercise, diet, all that. If you can, that's what the community paramedic was designed for, is to keep the patients out of the emergency room. So if you want to be one, that's what you have to do. You have to go to these people's houses, you explain their medications to them. I mean, in a way, it's kind of cool because of all the different medications that all the different people take and how it affects them and all that kind of thing. If you're a brainiac, that would be cool. Me, I want guts, blood, missing limbs, gunshots. I want the good stuff. Y'all get that up there? And
Yeah.
okay. They may include services such as increasing access to underserved areas, like people that live out where you have pipe sunlight to their house, and they only go to town once, maybe twice a month. No, they're not going to see the doctor, don't you? Providing advice to 911 callers via phone rather than dispatching resources. Use of especially trained EMS providers to help individuals manage chronic disease and follow-up care. So basically how that works is if you go into the hospital and you got COPD and they give you a couple of treatments and maybe a couple of oxygen, some steroids, things like that, COPD under control. The next day or so, they will tell whomever the community paramedic manager is, hey, I've got Charlie Brown over here, and he lives in 1215 Dogwood Circle in Yellville, Arkansas, or Lead Hill. Can you do a follow-up on him? We don't think he's taking his medications like he's supposed to. Can you go out there and explain this to him in a way that he will understand? And then this way, if you go out there and help him do that, then you don't have to, he doesn't have to worry about coming back to the ER with another COPD flare-up, because you help. Not only did you help him with the instruction on the medication, you might have been nice and made him a sandwich while you were there. I mean, I've put people's clothes in the washer for them. I've made them foods. I've helped them make their bed. When they weren't able to. That's part of your job. Because that's also part of being that patient advocate thing. Y'all want to sleep with a bunch of hay and garbage and stuff in your bed? So you would be willing to help an older person, take the dirty sheets off, throw the new ones on, throw them in the washer for them? I think kind of, let's show them a little bit of empathy and kindness. Don't cost nothing. What you get paid to do. EMTs are part of public health team. Public health does deal with protecting the health of the entire population. EMTs can play a role in identifying public health problems and attempts to reduce injury and illness and promote health. Take a break. You got 10 minutes. Y'all got 10 minutes,
All right.
okay? Oh, God. Yeah. Y'all ain't gotta get up and stretch your legs.
I'll
Yeah.
take my heart rates again.
Huh?
I said, I'll have to take my heart rates again.
What's your heart rate?
See, it doesn't matter what my heart rate is as long as it's under 60. But
What do you mean?
I'm supposed to take it if my heart flutters.
Well, you got atrial fib?
Yeah, probably.
I do too. Atrial fib with RVR.
See, Choppy, he's listened to my heart and he's pretty sure it's AFib, but my cardiologist doesn't want to confirm it. My cardiologist has literally told me that I have a valve in my heart that is supposed to seal all the way, that has yet to seal all the way.
Regurgitate.
Yeah, but I've had this issue for like the past 6 or 7 years. So if it was gonna close on its own, I'm sure it would have done it already.
I just put 2 and 2 together. You're dating Chris. You got a finger.
Huh?
Or have you got a finger? What is wrong with you? Don't be messing with that boy. That cool.
So I'm not the only one that's cold?
Yeah, no, I've been sleeping this whole time. I went out to grab my sweater. I'm cold all the time. I've got poor circulation. I had cold hands all the time.
See, I have poor circulation. Temper is easy, but nobody wants to tell me why. I'm not anemic. Yeah. My mom's anemic, and you could literally poke her and she bruises.
It's not, I get bleeding, but like, and it's not as bad right now, but like just randomly,
That's from getting poked yesterday.
like randomly, like I can feel my hands. I'm like, I can touch them. It's like normal temperature. And it's literally like ice. Like I put my hands in snow.
Yeah.
That's weird. Chicken scratch, I'm like,
We just turned that up. The office is heavy.
Hey, listen, not anything to get me. Okay, but that
I
day,
think that's the worst I've seen so far.
I think so. Everything in that bathroom echoes, so that even made it worse.
It didn't.
You missed it. I about to stop myself. The dang air dryer
You
thing.
know the blow dryer
It
for
doesn't
your hands.
ever go off. I'm sitting there trying to wash my hands. The damn thing goes off.
And champagne jumps back.
Hey, it echoes in there. Now, if anything, it caught me off guard. I'm not focused today. Hey, I've had a rough morning. Car versus Talon Pool took out my power.
Second I left my house, my boyfriend called me. He's like, you should be thankful you're going
the opposite
go the
direction.
other way because I usually cut through Flippin
Uh-huh.
to get to here because I live in Wolf Shoals. But today I went over the dam and my boyfriend's like, well, there's a truck in the ditch across the street from Ranger. I was like, oh.
She told me that she was half tempted to turn back
I
around
was
and go see
really
it.
half tempted to turn back
What?
and just see the truck in the ditch.
Cause I just,
What the fuck? That's a good phone call.
that is, I know, I saw it, so I was like, is that his jacket?
We want to choose some out from the office.
Like the state,
Yeah, like that one about,
like where Las Vegas is, Nevada.
yeah, like we were 6 hours from Vegas. We were an hour from California.
I don't know where it was.
Long trip, 8 hours away.
All right, everybody ready?
Ready.
All ready?
Let's get a little back in there.
Y'all ready in Missouri?
Yeah.
Okay. Core functions of public health include assessment, policy, development, insurance, assessment, collecting, assembling, analyzing data. Policy development, policies and plans support individual and community health efforts, assurances, ensuring provision of health services. Assessment. We'll move to the next one. 10 greatest public health achievements in the United States, 21st century. Vaccination, motor vehicle safety, workplace safety, control of infectious disease, reduction in deaths from coronary heart disease and stroke. Are they vaccinated for? MMR, TB,
Smallpox,
smallpox,
measles,
chicken pox, right?
what? That's what I was thinking of, HIV,
AIDS,
Hep B, Hep A, Hep C.
COVID,
Yeah, that's a good one.
flu. They kind of screwed up the COVID thing.
Yeah.
Motor vehicle safety, what have they done to improve that?
They put in things in vehicles that
The seatbelts that work,
seat buckles, they also have the blinkers,
airbags,
airbags.
Also, it's our safety standards now that they've passed.
they all had hazard lights.
My truck don't, if you get too close to something, we're backing up, they'll brake for you.
My wife's truck, if you set the cruise control and it starts approaching another vehicle from behind, it will automatically slow down.
I wish my car did that.
I thought it was something wrong with it.
I got cruise control, but mine doesn't make
They
sense.
have vehicles, they have vehicles that
Keep doing it.
if you get too close to somebody on the interstate, it will start switching lanes. If the vehicle next to you gets too close. No, it is. No, when you're going 90 down a 6-lane highway, it's terrifying.
And the Escalade, if you're back,
That's how my rental was.
it has like a little light bar and it gives a sound if you are getting way too close to something like you.
They've got some now that if you even get too close to the white line or the yellow line, it'll vibrate your seat.
Someone else.
That's great.
It's even on semi trucks too. When my dad was driving a semi truck, if it got too close to the white line, it would make it sound.
So what do y'all think about the vehicles that drive themselves? Would you get in one?
Oh, yeah.
Absolutely.
I don't trust it.
Did it one time. At one time.
You know what I'm talking about. Would you do it?
Yeah.
Would you get in the back and let it take you wherever?
Yeah.
That you want to go?
Yeah.
What about you guys?
No.
No? Okay, what do you think they've done in the workplace for safety?
Hard hats that reflective vests.
Okay, what else?
Security guards?
Masks.
So we've got safety vest, hard hats. What have they done in most public places that there are lots and lots and lots of people that they have installed? AEDs, right?
Yeah, we've, out my work, we have, I believe we have an AED there, but we also have multiple different first aid kit stations throughout the entire building. We have one, a couple up in the.
What's your building?
Huh?
What's your building?
My building is Walmart.
Yes.
We have some in the OPD, which is my part of the building that I work.
Mm-hmm.
We have at least 2 or 3 from produce to GM and grocery.
Yep.
And we have one in the over by the fitting room.
So you think that's an improvement?
We also have spill stations and all that around Walmart as well, just in case something like spills or breaks and someone gets an accident, we have that around as well.
That's pretty cool. Control of infectious diseases.
Face masks.
There you go. What else?
Sure that no one stands, some workplaces have that.
What are these that you put on?
Gloves.
You got gloves, face masks. They even have face shields now. You also have the reduction in deaths from pulmonary heart disease and stroke, right? Safer and more healthful foods. What do you think that means?
The food isn't as harmful to your body as it should be to help your overall health,
Okay.
I think.
So they eliminated red dye in your food.
Yes.
What do they call?
Reporting,
What might it cause?
it causes,
Cancer?
cancer, I know.
For some people that have ADHD, it could cause their HP to go haywire. It does
Okay.
for my sister.
So they've labeled. How many of you have peanut allergies? Nobody? Do y'all?
No.
No?
Isn't that the most common allergy in the United States?
What?
Isn't peanut allergy the most common?
I do believe it is. Decline in maternal and infant mortality. Use of barrier devices during sex. So that would prevent you from what diseases?
HIV.
HIV?
Sexually transmitted diseases.
So like syphilis,
Chlamydia.
chlamydia, gonorrhea, warts, genital warts, those kinds of things. Right? Ain't have none of that. Fluoridation in drinking water. What does fluoride do for your teeth?
Strengthens your nails.
Makes them stronger. Recognition of tobacco use as a health hazard. What do y'all explain that?
Can cause lung diseases.
So,
And there's state laws passed that now, like gas stations and all that have to have those signs that it's recognized that it causes cancer and stuff.
Yeah. Yeah.
and it has to be on every package sold.
Yes.
They put on there nicotine is an addictive chemical. They also put on there that the use of tobacco can cause cancer, right?
Yes, and also cause birth defects when you smoke when you're pregnant.
Yeah. So your public role in your EMS, you will be, once you go out in the public, if you want to be an instructor, you will go public CPR. You will teach like stop the bleed, different things like that. Here we go. You may go, out here every year. Baxter has a health fair, and you can go out there. You can volunteer. You can take blood pressures, and you can do all kinds of little things, and just talk to some of these little old people. You'd be amazed at what you learn just by talking to, somebody 80, 90 years old that are still with it. They got some cool stories.
They do.
I've transported chemical engineers. I've transported people that have worked for NASA, World War I, World War II vets. You just go out there and be nice and, take these people's blood pressure. One, it's enhancing your skill as far as taking blood pressures, checking pulses and doing the pulse ox. And, it's just a little thing, but to them, that might be a big thing. That someone actually cares enough to take the time to do that. And it don't take but, a minute and a half, 2 minutes? to do all three of those things? I got people down the boat dock, come down the boat dock right now. Hey, can you take my blood pressure? Sure. Take your blood pressure. Can you get this fish hook out? Sure. I'll get your fish hook out. You know, don't cost nothing to be nice, does it?
What's the craziest thing you've had happen at the boat dock?
I had you're talking about while I was on the truck?
Yeah.
Yeah, I got a 88, 90-year-old man. He had taken his wife out fishing and it was cold. They came back. He stepped out of the boat. He stepped onto the dock. He went to do something with the rope on the boat. And there's a gap, and the boat slides up. Well, there's a gap right here on the right hand side where the bow of the boat is. He turned around and did something, and fell right in. They had to go get him. He was probably 40 foot deep. So they went down, brought him up. By the time I got there, because I was in down home dropping a patient, I had to haul butt all the way back to the boat dock. And they were doing CPR, and it was cold water drowning, so you can do it a little longer. And we never could, I had to call it right there. We were doing CPR right on the dock. I was there for 30, 35 minutes coding, and he just wasn't coming back. The cold got him, got to his heart. That was it. But that's not really crazy. I remember their TV or recording me. Got it? So when you get on the truck and you go to these little public events, every little kid loves the fire truck, the big red truck, right? They all like getting in the ambulance. Till you go looking at a needle with them, then they're out.
Hey, they're gone.
But it's okay to take your oxygen mask, your normal breather, your nasal cannula, just take extras with you. Let them put it on their face. Put the nasal cannula on their nose. Let them feel the oxygen. Let them do all that, because to them that's cool. Social determinants on health. Economic, 5 domains of that. The economic stability, education, access, and quality, healthcare access and quality, neighborhood and built environment, social and community context. Prevention, education, and wellness. EMS assists public health through multiple functions: primary prevention, secondary, and tertiary prevention. After giving a report to the emergency department about Ben's condition, I'm surprised Ben's still alive after all this time. And pre-hospital treatment, Alexis compliments Peter and Juliana on their assessment and care. Peter takes the opportunity to ask Alexis a few questions about the patients who present as Ben did. It was discharged from the hospital with cardiac pacemaker. He was heart beating at the right rate. He participates in a cardiac rehab program and is working with a nutritionist on his diet. He still frequents days, but more often than not, oxwood or a bowl of oatmeal with fruit. What does that tell you?
He's not going to be eating a whole lot of this.
Ben has been denied all fried food. Fried bacon, fried sausage, fried eggs. You don't get none of the good stuff no more, does it? Bowl of oatmeal with some fruit. You might as well just put a halter on him and put him out in the pasture. Right? Oh, I like oatmeal, especially in the winter time. It's good.
Yeah, oatmeal is good.
Lesson summary. The shape of modern EMS system is influenced by many events throughout history. EMS systems must address 10 specific areas as defined by the NAPHCA or SA 911 is the access number for EMS in the United States. There are 4 nationally recognized levels of EMS providers in the United States. Y'all need to know that for your test. Even on your national registry test. You have several specific responsibilities. You also need to remember not to go above your scope of practice. Medical direction and QI are essential components of all EMS systems. EMS practice and change over time, based on research findings. The whole integrated healthcare system and community paramedicine will continue to evolve and shape EMS. EMS is a part of public health system and can make an impact on the healthy community. I think we're done. Yeah.
It's not for today.
You guys done?
Sorry, what?
Are y'all done?
Yeah,
Does that mean you have to go to another class?
that's not for us.
Oh, okay.
And that wasn't for us, it's very well.
Same thing he said.
Hold on a second. Of course you can. All you do is hook it up. Everywhere fine, ain't it? Okay. Really don't make it run. Okay. Bye. Okay.
Someone's getting beat or something.
Yeah,
Huh?
Just that it sounds like someone's getting beat or something.
Y'all sure are making a lot of noise up there. What are you doing?
You can turn it on to where you can see them now.
I don't know that.
You just gave me too much words.
It's mushrooms and.
I just gave it to her.
I
They can go down where the one
There's
is.
a mushroom ingredient into it.
That is awesome.
Yep, there they are. Click on the first one.
Middle left screen.
There you go. Now you can see them.
There you are. Yeah, I see you. What are you doing with that cup? You busted.
She's trying to put her lid back on. Better, it might be full of ice, and she's trying to put the straw back in.
That is true.
Are you done jacking with that?
Yeah, she's done.
What?
Can you talk?
Yeah.
Well, then answer me. See, because all of these guys in here can see everything you're doing.
I think you just make her feel a little bit embarrassed or something.
All right, we're gonna play a little bit. You Matt, you, and you. Come on.
Aren't you supposed to?
No, I don't go to school already.
Okay. Who wants to be the EMT and who gonna be the patient? You jumped on that one, both of you. Huh? You jumped on that quick.
You be the patient next time.
You go, patient.
No, I'm screwing with these.
Hey, when you're doing your patient assessment, what's the first thing you go do? Because you are the EMT right now.
What's the situation?
Oh, you want a story?
What's wrong with her?
You have a 42-year-old female patient. She is in the Walmart in the bathroom, and she's on the last commode on your right. That's all you got.
Yeah.
You want to be a victim.
Tag your in.
Okay.
It's No.
So, is the door locked or is it unlocked?
It's like, just kick it down.
You are dispatched to that 42-year-old patient on the commode, right?
I don't like that I can see the monster.
Hey, so you can see this stuff, at least we know that you have head trauma. So at least we'll know you have head trauma after that.
Some kind of trauma.
That's all the information they give you.
I can't even
Commode, what is?
Really?
The toilet.
Literally.
It's hurt.
I shouldn't. Yeah, I walk in. Ma'am? Hello?
So what have you determined?
She's able to speak to me.
So she is conscious.
Yes.
Is she alert?
I don't know what's wrong with me. What's wrong with me?
Alert means asking if you know where you are, basically.
Are you all right, ma'am? Do you know where you're at? You need any help right now?
Yes.
Are you able to open the door? Are you able to get up?
No.
Alrighty. Would I have to crawl under the door in this situation?
In this one, you might.
Or you can just, you can,
Should I get off the chair for this?
Are you able to reach the door from the situation that you're in
So
currently?
hey, Jake, can you unlock that door? Do I need to kick it in on you?
Contemplating. I don't think I can unlock the door.
Alright, we're gonna have to come under, kick the door open.
So you need this nice little skinny, this nice skinny little EMT partner of yours that is big as a french fry. Those are the people you send under the door.
Mhm.
So what you would do is what? Tell me. If she's in there and she can't reach up far enough to get the door unlocked.
Ma'am, I'm currently having my partner go under the door and open the door so we can come in and assist him.
Are you decent?
Do
we need this?
if you are uncomfortable in the situation that you're in, if you need to cover up, pull your shirt down.
Uncomfortable.
We send Superworm under the deal. He crawls under there. He pops the door open. He's standing beside of her as he comes up. He comes up right here. There's the handle. He pops the door open. The door comes this way. She's not 18 feet tall, so the door don't hit her in the head. He unlocks the door. He's, there you go. You're in charge though.
Okay.
He's just your helper.
Okay, she's on the ground, obviously she can't
On
reach
the toilet.
on the toilet.
No, Scrappy's right. I am on the ground. You told me I was on the ground.
Well, you're on the toilet.
You told me I was on the ground. I know you're thinking I'm on the ground.
Okay, you can be on the ground right there.
Okay.
That's just making it harder on them too.
Nah, I made it even harder.
So if you're on the ground, get out of the chair.
I asked you if I needed to be out of the chair. You didn't say anything.
I didn't hear you.
I'm just sitting on the ground. Then.
Nope.
No, you need
Not
to lay
sitting
it.
on the
I gotta
ground.
lay on the ground.
You gotta lay on the ground.
Go for it.
Oh, he's laying on the ground. Side.
There's the toilet, she said.
Curled up. Yeah.
So what do you think you should do?
I'm glad they can't see me anymore. Oh wait, they kind of can.
Can y'all see her?
Yes.
Yeah.
We need to back up against the wall.
No.
That's good.
It's fine.
Alright. So what do you want to do?
I wanna obviously help her and assist her, but I don't know.
How you gonna do it?
Get me off this dang toilet.
Well, I have to know.
To make up my mind. Are you in a floor? You want to promote?
That's the toilet, so you are.
You're away from the toilet.
You are caterpillared around.
Caterpillar.
How do I get this position?
So, you establish-
You can what?
What?
Okay, so just crawl.
You've established that she is alert, she is oriented. You know where you're at, ma'am?
In the bathroom.
Where?
Around the toilet.
Just where you at. What city are you in? Okay, see,
Okay.
now you know she's alert, she's conscious, she's oriented times 3, person break time. Where you hurt? Which one? Did you fall off the commode? What did you do?
It seems like it.
Okay, it seems like it. So, was you pushing too hard and pass out? And fall off the commode and hurt your hip? What's up?
I'm not sure. I blacked out.
You blacked out. So now you got more ammunition. She blacked out. So, for example, if you're on a commode and you push too hard, it will cause a vagal response and you will go unconscious, depending on how hard you push. So, an example of that is sit up in your chair right now, all of you. And I want you to put your fist right here. I want you to stare down like you're taking a poop. Serious. I mean, just take all your guts, everything is good.
Make them do it.
You could do it.
I'm here laughing at this.
Stop, Molly. Get your hand out of your mouth. Yes, I can see you. And just grunt, bear down.
Me?
All of you, not just you. Everybody go on the count of 3. 1, 2, 3, go.
Just like a tight.
Now, do you feel what I'm talking about?
Yes.
Yeah. When you reach a certain age in your lives, it's called a vasovagal response is what it is. Because you're shunting, you're pushing with your mind and everything else because you're trying to get it out. Okay? People, when they push too hard like that, this is no BS. It's for real. When you push too hard like that, they will have what they call a vasovagal movement. And when they push down, when they come back up, because they pushed down so hard, they shunted everything to push. And sometimes they will actually pass out and fall off the road. It's a real thing. Okay? So we're assuming, of course, you know what assume means,
Yes.
that it's possibly that's what it is. So she's alert, she's conscious, she thinks she blacked out, she's complaining of right hip pain, right? Now we go. So if you can get in here, right, Maggie, when you passed out, did you hit your head?
No.
Do you have any pain in your head or in your neck?
No.
What about your back?
No.
Okay? You said it was your right hip.
Yes.
If I touch your left hip, does it hurt?
That's my right hip.
Well, okay. Not sticking my hand for your butt. So this does hurt.
Yes.
Okay. So what we have to do to get you out of here is get you and roll you over onto your back. Considering she has no neck pain, no back pain. She's not complaining of any C-spine or anything like that. On the count of 3, I'm gonna help you roll over onto your back. Wait, lay in there.
We're counting.
So,
I was waiting on 3.
3.
Counting.
How does your hip feel now?
More relaxed.
More relaxed? Sometimes when you put them on their back, if it is a fracture, dislocation, by simply putting them on their back, it may make it worse. So what you can do, if it's worse, you can also raise this leg up just like that and get the pressure off of the hip. So if her foot is down, just put down pressure on her and she'll holler. So if you just wrap it up like that, put a blanket on here or a towel roll or something, and just let her relax that leg back down, that gives her some relief. I mean, you just can't pick her up and jump in the cot. Well, you could, but you get in trouble. So how's that feel? Is that better? Okay. Now, I'm going to ask you, I want you to give me your hands, and I want you to set up for me. How's that?
A lot better.
Is that okay? How's your hip?
Hurts.
It still hurts? Okay. So what we're going to have to do, because you're in this tight spot here, knowing you, come right here, walk in between her legs. Foot down, because you're going to use both hands. Now, I want you to get her under her knees. And what we're going to do, I'm going to get her arms like this. Okay, Maggie, what we're going to do, on the count of 3, we're going to pick you up. And we're going to put you in a chair. Okay? Ready? 1 and 3. Just lift. Put her in the chair. Okay? Now, can you wiggle your toes? Which toe am I touching?
My big one.
Okay. Does that hurt when you do that? What about this? I lift your leg. Does that hurt? Okay. So now that you've assessed your patient, you can actually take her and roll her out. And then you can actually get your cot. You'll have plenty of room. Once you get out of the confined spot, you can take her, roll her to the cot, set her on the cot. Okay? That make sense?
Yes.
What about you guys?
Yeah.
See all that?
Yeah.
All right. You go home now. No. What else are you going to do for this patient?
Am I not dead?
Oh, you ain't done?
Shoot me now.
So you get her in the back of the truck, or your truck is way up yonder. Because you couldn't get to the front door. Because you have a Band-Aid buggy, they said, no, we're not going to let you in. You got to roll your stretcher from wherever all the way down here. Copy.
Can we have the EMT helper go get the vehicle and bring it to us? No.
Sure. You can do that. Because what are you gonna be doing now that you have her in a safer environment? Now that she's not on the floor with all the pee and all the poop from the phone. Well, you know. What are some of the things that you think you're gonna do for her? You got your bag with you.
Would I take her vitals just to make sure that she hasn't
You'll get back.
anything?
Yeah. We're gonna check her what?
Her vitals?
Alright. We're gonna get a blood pressure. Oh, that one.
They got one.
Okay, she's alert. Right?
What's next?
She's not alert. Every time 3. That's right hip pain, right? This thing sucks. Right hip. You got her from the floor, off the floor, around the commode, into a chair. She seems to be tolerating it pretty well. So you sent Gomer after the truck. Not that your name is Gomer, but you went and got the truck, right? You have all your stuff with you. Equipment. What's your equipment with you right now? What could you be doing?
Taking her blood pressure,
Okay.
checking her heart,
Vital signs. Respiratory rate is what? Take it. What do you think it is?
the way that she's breathing.
Yeah, what's her rate?
I would check it with my stethoscope by hearing her lungs, right?
You gotta look at it, take it.
Look at how many times she breathes. I like that quality.
All you gotta do is watch the chest rise and fall. 15 seconds or 30 seconds. If it's 15 seconds, multiply it times 4. If it's 30 seconds, multiply it times 2. So she's breathing about 12 right now. 12 breaths per minute. I didn't just stand here talking to you. Okay? Blood pressure. What do you think it is? We should make one up. You make it up. It better not be perfect.
140 over 80.
Okay? Could that 140 be elevated to 140 secondary to a little bit of hip pain, you think?
Yeah.
Okay. Heart rate, what is it? Think it's gonna be up a little bit because she is in pain? What, 90?
90, 92.
Okay. What else? What you be doing? What did I just do when I set her in that check? What did I check?
Asked if she was still breathing.
Okay, what else did I check?
That she was still able to communicate and
If she has any SMCs, what are her sensory motor control? That's your digits, your arms. And if you don't want to go, take her shoe off. Can you wiggle your toes for me? And you can take for a pulse right. You can check her feet pulse. Which toe am I touching?
the big toe.
Oh, her. That kind of thing. You can be doing all this while he went to get the Band-Aid done. You can also ask her, you know, are you allergic to any medications? What is your medical history? Have you had any surgeries? blah, 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 blah. You see where I'm going with all this?
Yes.
You can have most of her stuff that you need to do done by the time he gets the truck to you. So when he gets there with the stretcher, all you gotta do is set her on the stretcher, load it up. Because you checked her SMCs, you've asked for medical history, allergies, stuff like that. Even though you're an Emmett, you can't give, you can't give the medication, but you can have all this stuff ready for when she goes to the ER. Then it'll all be right here. Because I always wrote on my glove. That was my notes when I was a paramedic. 82-year-old life patient, blah, 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 complaining, blah, 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 blah. And then on this side, vital signs are blah, 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 heart rate, blah, cardiac monitor shows, blah, and then treatment, I would go down my arm if I had to. O2 IV monitor, blah, blah, blah. If I gave her pain meds, I gave her 2 to 4 milligrams of morphine sulfate at 0810, flushed with saline, blah, 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 blah. Wait 2 minutes, patient Stacy felt much better, whole 9 yards. You too will be able to give a room report just like I rattled that crap off. You don't think you will, but you will. I promise. What are you gonna do now?
Is the truck here now?
Sure, it's here. You got all these people to help you. They showed up all of a sudden.
Well, I took my partner to help.
Well, she lost 600 pounds.
That ain't not that.
There's got to be one in every crowd. Every crowd. That's okay, I'm used to that.
You're changing up my symptoms on me.
I didn't change your symptoms. You still had the only thing wrong with you got a right hip pain, and you passed out.
And I gained 600 pounds.
My job was to make sure that you didn't have any hematomas, or you didn't have any C-spine pain, any upper thoracic back pain, lower pain, anything like that. So I already checked you out, and that's what you do. It don't matter if you're 20 pounds or you're 600 pounds. Still got to get you up out the floor. Still got to get you in a chair. Still got to get you on the cot. Get you on the cot. Still got to get you in the ambulance. Still got to get you to the ER. You see what I mean? So, don't matter how much you weigh. Even though you don't weigh, you're talking about the popcorn part. So while you're assessing and you're finding out all this stuff, here comes Gomer. He's got the ambulance. He's got the ambulance right outside the door. He's got the stretcher. And you're going to put him on.
Is she still 600 pounds or?
No. No, she had a plug in her left hip. You pulled it and all the water ran out. You're good. So you're going to put your patient on your stretcher. You're going to secure her to the cot, and then you are going to transport her to the ER. Now, when you get to the ER, 10 minutes before you get to the ER, you're going to get a radio report. And if you're just saying, through Baxter, they say, Unit 3, go ahead. They'll say, this Unit 3, we're transporting a 42-year-old white female patient. She is conscious orientation times 3 at this time. When we got there, she was left lateral recumbent in between the wall and the commode. She was conscious. She says she thinks she blacked out while she was using number 2. Okay. She's not complaining of any C-spine pain, any lower back pain or back pain, just complaining of right hip pain. Okay? She has, her vital signs are, respiratory rate is 12, blood pressure is 140/80, heart rate is 90, 92, SMCs are attack times 4, pulse oxygen is 98%. We are transporting non-emergency to your facility. She has no medical history, no known drug allergies. We are transporting patient in position of comfort. We'll be there in 10 minutes. Are we good? The lot? What lot? Well, I keep mine short, sweet, and simple.
Short, sweet, to the point.
I don't care that her brother Leon had COPD and he had a heart attack and they put 52,000 stents in him and he has leg replacement and his right foot fell off. I don't care. We don't care about none of that. We care about what's going on with this patient at this moment. Besides, we're not taking care of Brother Leroy or whoever it is. We are taking care of her and her only. Make sense?
Yes.
Yeah. And even if she was split from here to here from a laceration, once you get that taken care of, or you have your partner take care of it, that's the joy of having partners. That's the joy of having multiple first responders that can help you. I can be doing this, blah, blah, blah. I can be over here checking her blood pressure. I can be listening to breath sounds. Well, guess what, Elvira? You're going to take care of that wound while I'm doing this. And when I get this done, she's doing that. I may jump over here. I may pop a line in her, put oxygen on her. Multiple hands, multiple eyes can do multiple things. You just have to make sure that the ringleader knows everything that's going on. See, because when I ask her, can you take care of that wound while I do this? And I'm not telling her, I'm not yelling at her, will you please take care of this? I know what she's doing. She knows what I'm doing. I had a partner for a long time. I never spoke a word to her. Didn't have to. When we got in the back of that truck, and it was business time, she had her job, I had mine. If she sees something I didn't see, she tells me. If I see something she didn't see, I'll tell her. One of us is going to fix it. You see what I mean? If you're out there in the street and it's a NBC and you have to strip your patient down butt naked, my partner is going to remember to bring a sheet or a blanket because we don't want Magdalene here laying out in the middle of the highway butt naked, do we? So having a partner, a good partner, and having good first responders that know what's going on and know how to take care of people, because we're all pretty much type A personalities. You know what that is, right? Type A, type B. Type A are the people that get in there, they assess the situation like that, and then they go to fixing it. Type Bs are people who sit back and wait for type A's to tell them what to do. So you have leaders and then you have followers. That makes sense? So if me and Zach are partnered up, I will, if I've never met Zach a day in my life and it's his first shift, I'm gonna tell him, this is what I expect of you. This is how I want you to do things. Okay? Do your training, but tell me what you know, what you don't know. And you have to figure all that out before you ever get to toilet girl here. You know what I mean? And once you start ginning, because y'all know that most people aren't very nice, right? They don't want you touching them. They don't want you messing with their equipment. They don't, I'm the world's worst. Don't touch that. You don't know nothing about that. Keep your grubby little paws off my toys.
Reminds me of my dad.
But eventually, as I teach you, I will trust you. And then you do whatever you want to do. Once I know I can trust you. You know, because when you go messing with that monitor, that's 30, 40 grand right there. People don't care. Guess what? I care. I have to work with it. I want to know it works. I want to make sure it works. I want all these things to happen. You know what I mean? So you've gone to the hospital and you gave a report and you walked your patient over. So when you do your patient report and all that stuff, you're doing it like 4 times. You're doing it in your head as you're doing your patient, as you're taking care of your patient. If anything changes from that chair to that truck, you're also doing that too. You're popping that in your head. Now, once you get them in the truck and you get them loaded, if you were to immobilize that hip, you would have to check your SMCs before you immobilized it. Then you would check your SMCs after you immobilized it to make sure everything is still working. Does that make sense? You put them in the truck, you've readjusted what you just did because you moved it from the chair to the stretcher to the ambulance. So how many things can change between 1, 2, and 3? A lot. A lot. So as soon as you get in the truck, if it's been 2 to 3 minutes, check her blood pressure again, check her SMCs again, check her pulses again to make sure it's all still like it's supposed to be. When you start going down the road in your truck, say you're 40 minutes away. How many blood pressures do you think that you need to take if she is stable in 40 minutes?
I don't know.
If she is stable,
Oh, then
One or two.
1 or 2.
maybe 3, maybe 4 if you're super energetic. Which I know some of you people are because you're still messing with your cup. Hello? Pretty quiet, aren't they?
Yeah.
It's just weird to me.
I think you need to have them stand up and do jumping jacks.
Y'all want to stand up, do 10 jumping jacks, make sure you're still alive?
Well, we're still alive. I'm good.
Right? Everybody go like this. Now you know you're alive. You're good. Are you getting what we're talking about?
Yes.
Do you understand?
Yes.
Okay. I'm watching you. Purple cup, I'm watching you. What do you got in that moonshine?
Ice.
Now,
Ice.
yes.
Is it purple?
It looks like a bit purplish too.
I see blue.
So now you're getting a better envision of when you get there, what you need to do, how do you kind of need to do it, and then how to get it from point A to point B to point C. And then eventually you want to get it to the ER. But as things change from the floor to the truck to the ER, just remember that you make a mental little note. Hey, such and such, this happened on the way. And you just tell them. How big deal? Did I make it too hard for you?
No.
I have to learn on the 3rd grade level. I have to put this and this together to take care of them. And me, if you do more hands-on than you do anything, you will become little anal perfectionists at this. And just, you gotta remember that everything isn't perfect. I mean, I have brought traumas in with a stick tied to the back of their arm so I can keep my IV in place. And the doc said, who the hell put the stick back there? I did. But you have a patent IV that you can use for fluid, medication, or whatever you need. And they're like, well, that's a good idea. Yeah, that's all I had. You have to think outside the box, and you have to think of things that you normally would not think of or normally would not do because you have it. But if you don't have it, you better be thinking of ways to make it happen with whatever you've got or whatever you can come up with. We good? It's 10:45.
It's 10:46.
Excuse me.
Okay, good enough.
Hi, y'all. Bye, bye. Y'all have a good day.
Yeah.
Some of us didn't anymore.
Well, my goodness, really good PC. It's been an actual one. I can't use it for anything else besides school, so I'm kind of stuck. Well, my brother, he's huge. Oh, hell yeah.
I'm a huge Stitch fan,
My brother is a huge Disney guy. So, like, he went to Disney, he did an internship with Disney.
Hey, Scrappy, do you want this back?
You need it?
Did you roll it?
No, I literally like. I can get some stuff.
Yeah, because I was logged in.
Not like it ain't brand new, it ain't been infected with the.
And to help you be your instructor for the course.
Let's. Let me go.
And your footwear is metal. So.
I sent her email told her about, I sent her email and stuff.
You might have to go to your office.
They said it's better.
Well, hopefully it works out.
What'd you lose? Can't lose anything. Every time I try to sign into my Brady, it takes me to this. Every time I try to sign in, it takes me back to this part and tells me that you guys are not accepting registrations, even though I just went to sign in with my password.
So were you on the 2-week, free version?
I don't know, I bought the one online with my book.
Okay. Have you put it in yet?
Yeah, because we did that in class here that one day.
And it accepted it?
Yeah, I got in on that day, but now like it won't accept me. This is all, I'm just I'm not doing this. This is my pop-up one. Pops that I had when we did it in class.